Hello, my name is Dr. Terry Chappell, and I run the Celebration of Health Association in Bluffton, Ohio. I'm going to talk to you today about saving 1,000,000 hearts. There's a national program that is sponsored by the American Heart Association, the CDC, and several other organizations, and they want to really focus on saving 1,000,000 hearts over the next few years. Now, the problem is the way they go about it is that they are encouraging people to take a series of about 4 different drugs, and of course they want you to stop smoking and control cholesterol, and then there's always the option of bypass surgery or stents and angioplasty. Now, some of those things are certainly indicated, but we think we can do a lot better by doing complementary and alternative medicine to really improve the results. First of all, we put a bigger emphasis on lifestyle, and that's particularly with exercise and with stress reduction. Conventional medicine doesn't do a whole lot with stress reduction. We can actually do a test called a heart rate variability test that tells how much stress or stressful situations affect the heart and its function. And if it does affect it, then there's some exercises you can do that can really improve that. The next thing we do is we look at the different drugs that people are taking, and many times we can add supplements to substitute for some of these drugs and avoid some of the side effects that people often complain about. And then finally, one of the treatments we've been offering since 1981 or so is EDTA chelation therapy. Now, chelation therapy is a series of intravenous treatments that remove toxic metals from the body. And toxic metals is one of the risk factors that leads to heart attacks and strokes. This is a series of intravenous treatments that remove the toxic metals, and they also improve clotting, and they also tend to reduce the plaque, or at least make it less dangerous. Most heart attacks and strokes are formed when there's a plaque in the artery, but just a fairly small plaque that a lot of people consider to be insignificant. And what happens is that some of the fatty material inside the plaque leaks outside it, and then the body reacts to that and forms a clot around this leakage of fatty material. Now, that can suddenly block off an artery, or it can break off and go downstream and block off the artery further downstream. And this is the cause of most heart attacks and strokes. Now, notice I said this is in plaques that are only maybe 20 or 30% blocked. So the surgery that is done, the stents and the bypass surgery, is done on plaques that are more like 80, 90% blocked. So probably they're doing the surgery on the wrong arteries as far as preventing heart attacks and strokes. Now, in November of 2012, there was a really fun presentation because there's a tax study, the trial to assess chelation therapy, that's been going on for 7 years now. And the results of that trial was presented at the American Heart Association meeting, with 2,000 cardiologists in the room. And the results showed that EDTA chelation therapy had a statistically significant benefit in people that had known heart disease. In other words, they had fewer heart attacks and strokes, and they had fewer need for bypass surgery and for stents. So it was a landmark study because there had never been a study before on chelation therapy that was this large, and it was randomized and double-blind. And this did show statistical benefit in people that had vascular disease, but also particularly in people that had diabetes. We want to enhance normal function in Celebration of Health Association. We don't want to block actions of the body with drugs as little as possible. We don't want to send people off for surgery unless absolutely necessary. So if you're interested, we're very happy to talk to you further about saving 1,000,000 hearts.